Hello, my name is Dr. Diwan S. Raja. Today I will discuss a few multiple choice questions on atopic dermatitis. Let's start. Number one, a 6-month-old infant is brought to the pediatrician for evaluation of an itchy rash on her cheeks and flexor surfaces of her elbow. The rash has been present for 3 weeks and worsened with heat. Examination reveals erythematous scaly plaques with excoriation on both cheeks and extensor surfaces. Which of the following is the most likely diagnosis? A. Seborrheic dermatitis. B. Atopic dermatitis. C. Psoriasis. D. Contact dermatitis. E. Impetigo. Our answer is atopic dermatitis. B is the answer. Atopic dermatitis. Question number 2. A 16-year-old girl present with dry, itchy skin on her flexural surfaces, particularly behind the knees. And behind the knees means in the popliteal fossa area, and in the antecubital fossa, that is the cubital fossa. She has a history of seasonal allergies and asthma. Which of the following best explain the underlying pathophysiology of her condition? A. Type 1 hypersensitivity reaction, type 2 hypersensitivity reaction, T helper 1 mediated immune response, T helper 2 mediated immune response, autoimmune T cell attack. So, what is the choice? What is the correct answer? Underlying pathophysiology. Answer should be T helper cell 2 mediated immune response. D is the answer. D is the answer. Question number 3. A 4-year-old boy with history of atopic dermatitis presents with new painful punch out vesicular lesion on the top of his existing eczematous areas. He is febrile and appears irritable. What is the most appropriate next step in management? A. Prescribe high potency topical corticosteroid. B. Start oral antihistamines. C. Initiate acyclovir therapy. D. Order patch testing. E. Start oral antibiotics. So, this is a problem, atopic dermatitis. Now, a herpes infection started. There is a viral infection, and management should be by initiation of acyclovir therapy. C is the answer. Acyclovir therapy. Question number 4. A 10-year-old boy is evaluated for chronic eczema. He frequently scratches his arms and skin appears thickened and leathery. Which of the following term best describes this finding? Scaling, lichenification, hyperkeratosis, acanthosis, excoriation. So, which of the following term best describe this finding? Answer should be lichenification, thickening of the skin and leathery appearance and feeling. So here, treatment of flare of atopic dermatitis. Okay, a 2-year-old child with atopic dermatitis has been experiencing worsening flare-up despite proper use of emollients. Which of the following is the first-line pharmacologic treatment for acute flares? A. Oral corticosteroid. B. Topical calcineurin inhibitors. C. Topical corticosteroid. D. Systemic antibiotics. E. Oral antihistamine. So, despite proper use of emollient, we will, in this situation, will use the topical corticosteroid C. So, C should be the answer. A 7-year-old male is brought with a 2-week history of red, itchy rash on his cheeks and arm. The mother reports that baby has been irritable and scratches at the rash frequently. He was recently started on solid foods. Physical exam reveals dry erythematous patches with excoriation on the cheeks and extensor surface of both arms. Which of the following is the most likely diagnosis? A. Contact dermatitis. B. Atopic dermatitis. C. Psoriasis. D. Seborrheic dermatitis. E. Tinea corporis. Okay. We have dry erythematous patch and itching. So answer should be atopic dermatitis. A 3-year-old boy with atopic dermatitis presents with increased redness, warmth, and tenderness of an area on his leg where he usually applies eczema cream. There is also some yellow crusting weeping from the lesion. He has a low-grade fever. Which of the following is the most likely pathogen? A. Candida albicans. B. Streptococcus pyogenes. C. Herpes simplex virus. D. D. Staphylococcus aureus. E. Pseudomonas aeruginosa. We have secondary infection, yellow crusting and weeping from the lesion. There is redness, warmth, tenderness. There is infection, and there is some yellow crusting and weeping from the lesion. Answer should be Staphylococcus aureus. Okay, this is the answer, Staphylococcus aureus. Question number 8. A 10-year-old girl with atopic dermatitis come in for routine follow-up. Her condition is well controlled with daily emollient and intermittent use of topical corticosteroid. Her mother expresses concern about long-term steroid use and asks about steroid-sparing options. Which of the following is the most appropriate non-steroidal maintenance therapy? A. Oral corticosteroid. B. Oral histamines. C. Topical calcineurin inhibitors. D. Oral antibiotic. Code for cold ointment. Okay, so what is the most appropriate non-steroid maintenance of therapy? Answer should be topical calcineurin inhibitor. It is tacrolimus. Topical calcineurin inhibitor. Okay. Question number 9. A 2-year-old boy is brought to the clinic for a rash that was worsened over past week. He has history of atopic dermatitis and his parents report that he has been scratching more than usual. Physical exam shows erythematous lichenified plaque with excoriations on the flexural surface of his arms and behind his knees. His parents have been using emollient regularly, but the rash persists. What is the next appropriate next step in management? Okay, so oral corticosteroid, topical calcineurin inhibitor, oral antihistamine, topical corticosteroid, and oral antibiotic. Okay. So, Raj what's in our past week history of atopic dermatitis and his parents report. He has been scratching more than usual. Physical exam shows erythematous lesion-formed plaque with excoriations on the flexural surface of his arms and behind his knees. He is using emollient regularly, but the rash persists. What is the most appropriate next step? Next step is topical calcineurin inhibitors. Topical, actually not. The next step should be topical corticosteroid. D is the answer, not calcineurin at this level. Answer is D, topical corticosteroid. So once emollient is not working, then we use the topical corticosteroid. Number 10, a 13-year-old girl with moderate persistent atopic dermatitis has flared up despite consistent use of emollient and low-potency topical corticosteroids. Her lesions are located on her eyelid and neck. Her mother is concerned about the risk of skin thinning from long-term steroid use on these sensitive areas. Which of the following is the most appropriate next step in long-term management? A. Increase high-potency topical steroid. B. Prescription of topical calcineurin inhibitors. C. Start on all oral corticosteroid for maintenance. D. Use coal tar preparation. He prescribed oral antihistamine for daily use. So, what is the answer? Emollient she used, and low potent corticosteroid also used. Okay, so in that situation, if the low potency topical corticosteroid does not work, we can use the we can use 2A, one because it is sensitive area on the eyelid and neck. So steroid for a 13-year-old girl may not be appropriate. Answer should be this. Will prescribe topical calcineurin inhibitor. B is the answer. Topical calcineurin inhibitor. And that's all about the multiple choice questions on atopic dermatitis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.